Well, good morning, everyone. This is Jeannie White, Social Connections at Passionate World Radio, and I'm broadcasting from Dedham, Massachusetts. And today I have Dr. Tara Kay, and she is into the holistic, and she's also a children's book author. And welcome, Dr. Kay.
Thank you, Jean. I appreciate being on your show this morning.
I appreciate it, too. Do you want to give a little highlight to our listening audience?
Sure. So, as you mentioned, my name is Dr. Tara Kay. I am a holistic pharmacist. I have been practicing for 20 years now in myriad settings. I started off my career working for pharmaceutical companies and did some pharmaceutical advertising work and retail. And my most recent endeavor is to take a part-time consulting practice that I've had for the last 10 years and make it a full-time opportunity. And the name of my business is Kenko Wellness. I have office space in Lynn, Massachusetts, and I also split my time between Lynn and the Healing Way Center up in Andover, so I see clients in both locations. And what's unique about Kenko Wellness is I have learned to blend my very Western pharmacy training with Eastern modalities, and I take a very unique and individualized approach with each client depending on what their need is. And so part of the service that I offer is what I'll call medication management therapy, and that's looking at someone's prescription medications if they're on those, vitamins, supplements, herbs, and looking at how all of those can be incorporated safely together. There might be some individuals that are on prescription meds that are looking to come off of them, so we can look at things like that. And I also do a variety of energy work, craniosacral therapy, Reiki, emotional freedom technique, and after a workshop this weekend, I'll be adding morphogenic field techniques to my repertoire, and that is muscle testing. So after this weekend, I'll be able to actually test various supplements and medications to see whether they're best suited for a client or not.
And I think it's excellent what you do, Dr. Kay, because I go to Dr. Mark Mincola, and he's in Braintree, and he's a holistic physician also, and and when you said the muscle testing, he does that muscle testing on me too, when he's testing to see if a particular vitamin or supplement will work for me. Is that the same thing that you do?
Yep, that is the same thing, and I actually have worked with a couple of practitioners up here in the North Shore area, and each of them does it, but they do it a little bit differently. And I thought that is just it's fantastic. It's such a cool tool, and instead of just throwing medications or supplements at people in the hopes that will relieve whatever their ailment is, why not really test it on their body to see if that's the right product for them?
Yeah. I mean, it's worked very well for me, Dr. Kay. It really has. But your holistic procedure that you do is just absolutely phenomenal. Now, how do people get in touch with you? Do they call you, or do they go on your website? Do you have a website that we can use for the?
I do. My website is www.kenkowellness, and that's KENKO wellness.com. And I've had a number of people ask me, well, what does that mean? And Kenko is Japanese for health, and my fiancé is half Japanese, so I cannot take credit for the name. He's the one that came up with it. But I
think it's an excellent name. Excellent. It really is. When I talk to you, honest to God, I don't mean to interrupt, but when I talk to you, I think about my person. I go to Mark Mincola, and I get that same feeling that I have with him that I have now. I can feel with you.
Excellent. I have actually, I've heard of him, but I have not had the pleasure of meeting him yet.
He's you know what? At some point, would you mind if I mentioned your name to him? Because I do see
that
him
would
a
be
lot.
Great. Somebody else has mentioned him as somebody I should probably connect with, so that would be my pleasure.
Yeah, you really should. Okay, I'll take care of that afterwards. But let's go on with, all the different things. People can contact you, and your offices are easily accessible to individuals, and you find that, by your treatments and everything, you can go a long way with helping individuals in a holistic environment.
Yes, so for people that are up in that sort of Andover, southern New Hampshire area, I usually will feed them into the Healing Way Center. And that sort of allows me to do some work closer to the Boston area and then be able to tap into that sort of northern Massachusetts, New Hampshire market.
That's excellent, really. And how, you really absolutely must have an absolute passion for this.
Oh, yeah. It's something I have wanted to do full time for the last 10 years, and at the beginning of May, I lost my full-time job as a independent retail pharmacist. Sadly, they were bought out by CVS, and at that time I realized, well, this isn't exactly how I thought things were going to play out. I had envisioned working full-time and building my practice, but I think the universe had other things in mind for me, and I really tried to embrace that. It certainly was scary at the beginning, having had secure income for most of my working years to all of a sudden have that uprooted and have to file for unemployment and borrow retirement funds to, get myself going. But I've met a lot of wonderful people, and I think timing is everything, if that's one thing I could share.
Yes, you can. I'm sorry.
It's been an interesting adventure this summer.
I bet it has, but isn't it amazing? How I know people say how one door closes, another opens, but how I believe the universe does intervene and put you in a situation when it's like, okay, this is not the direction. We're going to point you in another direction. And you took heed and you did it. A lot of people wouldn't have done it, but you took the courage to really get involved into your practice. And I just believe that the universe does have a big part in what we do.
It certainly does. My mom likes to say the older she's gotten that timing is everything. And when I began this as a part-time practice 10 years ago in Connecticut, I had a lot of people saying this is awesome, like this healthcare really needs this. And so lots of positive feedback, but when you're trying to pioneer something, timing is everything.
Yes,
and
it is.
At that time, nobody was doing what I'm doing, and you were just starting to see some of the local physicians go off and form these concierge medical practices because a lot of the healthcare professionals are getting set up with insurance.
I agree. And then plus with your your Reiki, background and everything, and that is part of the holistic community because I am myself a Reiki master. I'm a certified yoga teacher and
awesome.
a soul coach. So I do believe in that philosophy. I think both work. Sometimes the Western and Eastern can work together, but you have to, understand what it is your clients, your patients are looking for, or what you want to help them with. I mean, I just commend you.
A lot of it is education. I mean, with all the years I've spent in the pharmaceutical industry, I mean, it's amazing. The other healthcare practitioners aren't aware of some of the Eastern or what we'll call alternative modalities that can be very complementary to Western medicine. And maybe in some cases, if you don't need to be relying on Western medicine, you can find alternative avenues. And it's just a matter of finding people that can educate you on it. Right. I certainly learned a lot over the last 10 years, and it's been fun and more creative for me to be able to blend both worlds with clients and then watch their growth and transformation. And my big thing is empowering other people to be their own advocates. I mean, I did it for years in retail pharmacy, saying to people, now I know, you trust doc and everything, but it's not just one doc anymore. It's multiple docs. It's big chain pharmacies and sometimes multiple pharmacies, and there's no more point person. You've got to be the point person. Mm-hmm. So to try to make things as smooth as possible, keep a list of all your medications and supplements and take that to all of your different appointments and try to keep everybody on the same page. So if, God forbid, something happens, the right hand knows what the left hand is doing.
Yeah, sometimes that doesn't happen a lot, though, especially in Eastern medicine. It really isn't. I see a lot of individuals that have, pages of subscriptions for medication and not knowing why or when or how,
mm-hmm.
they take all this medication. I'm not saying it's wrong. All I'm just saying is that people should really stop to pay attention and have an individual like you, Dr. K, that could, blend the two together, for them. Because sometimes, you keep giving medication and it interacts differently with the body. So with your holistic background, and plus, the Reiki and probably, exercising and diet, those all play a big
mm-hmm.
part in a person's body, in an individual.
It's huge, and that I definitely take a holistic approach when I'm looking at people. So I did do a certification in Ayurvedic nutrition, and nutrition has always been an interest of mine. So yeah, I'm looking at, well, what are you eating? Because maybe it's not necessarily they're having a problem with a medication or a supplement, but they just need to tweak some things in their diet. And, with the medications, like you were mentioning, you start seeing, medications being added, and sometimes it gets to a point where you don't know whether you're adding it because the person is really sick or you're treating the side effect of another medication. And that seems to be people that come to me, that's sort of where they're at in the journey. Like they're just totally set up because they're taking a bunch of meds and they don't feel any better. And then they're not sure, if I want to take this supplement, can I add it safely? Is there something that's herbal or more natural remedy that I could take in place of it? And in my kind of practice setting, I now have the time to be able to sit with them and explain things and take the time. And it's unfortunate that time is being lost in our healthcare system. And I think it's across the board. It's at the doctor's office. It is across the board. Physical therapy, pharmacy, you name it. Mm-hmm. And we're really doing people a disservice.
I guess it is happening. But I also guess, too, Dr. K, that there's more than one physician involved that's prescribing the medication, and not all of them are talking together.
Yeah, that's what I mean by you've lost the point person. It used to be the GP, and once upon a time it was the mom-and-pop pharmacy because that's all you had in town. And now, you've got these big chain pharmacies, and like all the CVSs are connected and all the Walgreens are connected, but those different chains are not interconnected, and then they're not connected with the independent pharmacy system. So if you went to CVS to get one medication, but they didn't have another medication, so you had to go to, Jones's pharmacy down the street, and you don't keep track of that, and you don't let somebody else know, then there could be a potential drug interaction or side effect from a prescribed medication that nobody knows about.
Mm-hmm. And so this is where you come into the equation with your your background in holistic and how to integrate. So I think you're really giving a great benefit to your patients, really.
I try. And it's fun. It's fun for me to be able to be more creative and out of the box, and really to be able to take the time and listen to what it is they need. Because sometimes people just want to be heard. They just want to be able to tell you what's going on, and they don't feel in some of these traditional settings like there's the time. I used to get people that would come in to the retail pharmacies and say, "Oh gosh, I don't want to bother you." I'm like, "No, please bother me. That's what I'm here for."
Right.
Yes, I have all these prescriptions to fill, but I want to talk to you.
Yeah. Well, this is what I feel when I go to Dr. Markman Kohler. He'll sit and he'll talk to you about certain things and what's going on, or what are you feeling, what kind of questions you have, and it's not like, 10 minutes and then you're gone type of deal. He does take some time to, and even just to discuss what his findings are, and he makes it very clear. And sometimes you can't get that, and I'm not downing any doctors because they're rushed out, they're they're busy, but they don't have the time to be able to say, well, Jean, this here would work because, they don't have that opportunity to sit and talk with me.
Right, because with a lot of these bigger practices, it's now sort of being dictated by insurance. So these poor docs are having to, fill X number of slots in a day, and sometimes back to back to back. Yep. And
it is. It's amazing. It really is. But you're filling a void. You're filling a piece, of your practice in helping, for solutions to the patient, and that's what people are looking for. They're looking for solutions.
Yep. And I should mention that anybody that is looking to make changes, particularly with prescription medications, so I cannot prescribe, and I cannot take people off of medication. So what we would do is we'd put together a recommendation that they would take back to whoever wrote the prescription to begin with.
Right.
So there's very much a desire for collaboration with their other practitioners.
Yeah. It just so happens my physician is very open to, when I talk about, my holistic physician, Mark Mincola, and they're very open to suggestions that Mark gives, and they'll work it out. But at least they're open to it. Some doctors aren't open to it, though, Dr. K.
This is true. Yep. And you sort of just have to, take it as it is.
Yeah, it's true, yeah. But on another token, if you want to just, can we diverge a little further and discuss, you are an author also.
Yes, I am. So last June, I published my first book. It's called Let the Sunshine In, a book of positive affirmations for kids. And basically what it is taking a negative statement followed by a positive statement, and then below that is a child's hand-drawn picture of what that positive affirmation looks like to them. And most of the drawings from that book were done by a local Daisy troupe from Gloucester.
Oh, and excellent.
It was, people said to me, did you ever think about writing a book? I'm like, no, I literally came home one night and I wrote it, and then sort of, tweaked it a few times after that. But I guess the concept was born out of some of my own experiences, and then I've been using positive affirmations for many years to get me through various life challenges and have found them to be very helpful. And I thought, well, what if you brought that to the youngest members of the community as a tool, and we started introducing things like that to the kids? What a wonderful asset that could be for them in their life.
Oh yeah, definitely. And I bet your children that had provided the drawings, I bet they were very excited about this.
Oh, it was a lot of fun. It really was.
Yes. And you also have a new book that came out too, right, Dr. K?
Yes. My second book just came out in April of this year, and it's called Free to Be Me, a book for teens and tweens. And my boyfriend's son was the illustrator. He's 16 years old, goes to Marblehead High School. And that book is very different from the first one. And I basically interviewed about a half a dozen teenagers between middle school age and high school age. And I said, so, what's going on with you guys? What are the issues that you feel the adults in your world need to know? And so that's sort of how the book is structured. And each of these kids, read the questions and gave me their candid responses. And then we created fictional characters to represent them. So there's a girl named Sunny and a boy named Ray. And I like to call them the perfectly imperfect characters. So they're not, your straight A student, most popular in class, and, you know, they're not the kids that get picked on all the time. They've got a little bit of both going on, like a normal teenager probably would.
Yeah. Well, this is terrific. But are they able to purchase these books from your website, or do they go to like Barnes & Noble or Amazon?
Yep, they can go to Amazon.com, and I do have a link to Amazon via my Facebook page.
Oh, you have a Facebook page too.
Yeah, the Facebook is Kenko Wellness.
Uh-huh. So that's another way for people to connect with you also is on Facebook, correct?
Yep. Oh, and besides the website, the email address is drtara@kinkowellness.com.
Excellent. I really like this name, Kinko. You know, it sounds really pleasant.
Yeah, it has a nice energy to it.
Yeah, it really does, you know, and I really want to be sure that, I mean, have I missed anything to talk to you about, Dr. K?
I don't think so, but I think I neglected to just give you, when you asked me about my background, to just give you sort of my educational background.
Okay.
And that was, so I did my undergrad in pharmacy at UConn, and then went post-bac for my doctorate because UConn at the time did not offer that to my graduating class. So I spent 3 years going post-bac for that. And then I thought I was going to be a corporate girl for the rest of my life. So several years after I finished that, I went back and got an MBA in management. So that was my traditional training. Yes, I was like school. And then about 10 years ago, I started learning about the Eastern modalities. So I got certified to be a Reiki master. And then from there, took a course in craniosacral therapy because that had been something that had been really helpful for me. And then the Ayurvedic nutrition, just because nutrition has always been an interest of mine. And I don't particularly use the Ayurvedic specifically. I sort of just grab a little of everything when I'm working with people. I don't tend to subscribe to one type of diet or another. I think it's whatever is for the individual's
however it suits them too.
And then the emotional freedom technique I learned, that was the last thing that I learned, and that's really been very popular this summer with people.
Is that tapping?
That is tapping, and the people that used to work with me years ago at CBS, they used to call me the tapping fool because I was always tapping on something, and I said, no, you guys don't understand. I like to self-experiment, and when something works for me, I get excited to share it.
And yeah, I don't blame you.
To me, it's such a wonderful and easy self-help tool. It's like, I can teach it to people, and then they can go and work on it, and if it's a deep-rooted issue and they need to come back, that's fine. But, it doesn't mean that they have to be dependent on me. It's something that they can do themselves and teach other people. It's been awesome.
Yeah, I have friends that do that. They do it and they use it in their businesses in the entrepreneurial section,
cool.
of business, and they use it. And they find it very, very informative and helpful to the individual that when they're learning how to tap. And I think tapping, is it really fully understood by, from everyone. It's a very simple concept to be able to use it, but it's so simple that it's very powerful.
It's extremely powerful. I mean, I can't even tell you. I've stuff that I've worked on that's happened when I was a kid that I've been able to clear, and I've helped other people with things that they've been carrying around. And I say that word freedom in the title is exactly what you get. And it's, the best way for me to describe it is just a sense of peace, where you had this emotion that maybe made you physically uncomfortable or emotionally uncomfortable. Once you've cleared it, it's just like, oh, hey, it doesn't bother me anymore.
Right. It's that simple. It's amazing how it works. When my friend, her name is Kate Beater, she's very good at the tapping. She has an excellent business, helping, freedom for entrepreneurs. But she had used it many years ago, I guess for ice cream or something. She was on a holiday or something, and found that it, by doing it, and then she released the desire always to have ice cream. I know that sounds crazy, but it worked.
Oh, I believe it.
Yeah,
I've seen all sorts of things, and people don't really know about it. I mean, just from what I've seen this summer, most of the folks that I've treated, I've had maybe a couple that have come in for medication-related things, but it's mostly women coming in for the tapping.
Yeah.
And it's, a lot of it is for some just being able to say whatever the issue is. Maybe they had a fear around just articulating it, but to actually sit down with somebody who's there to listen and to help is a huge part of the healing process.
It's just truly amazing, and sometimes something so simple can be so wonderful for an individual, but I guess not enough information is out there about tapping. There is, because I do get a lot of newsletters on groups that I like to be on, and but it is a piece of part of the holistic community, and it's a piece that needs to be worked on to help people to use it. And you're there to help them, Dr. K.
I am, and I like to tell people, that's one of those things, you can't do it wrong. So if there was any worry or concern like there might be with, medications or some other modality, tapping, you can't go wrong with it.
That's what my, Kate Beatis tells me. It's just there's no wrong or right. You have the thought, you put it there, and you just do the little whatever exercise she gives you, and and believe that it's going to work.
Yeah, I tell people, you can follow the script, because I usually will write out a script while I'm working with clients, and then give it to them to take home and work on. And I said, hey, if you're tapping and something comes up while you're tapping, maybe it's an emotion or something that we hadn't written down, go ahead and put it in, and just make stuff up as you go along, because you know better than I do what the issue is, and what's going to bring out a response.
Right. But sometimes people don't believe it can be that simple either, I guess.
Yes, this is true.
Very possible. Well, Dr. K, I can't believe that half an hour has flown by so quickly.
Oh, my goodness. Well, it's been a pleasure.
It has been a pleasure, and I want to thank you for coming on the show. And you're more than welcome to come back if you would like, if you have something you want to talk about. I do have a huge listening audience. And,
awesome.
And I think I always like to do this sometimes, to put a face with the name. And if I did like a Zoom, and of course it would be Zoom, I would pre-record it for you, and then maybe show you books or something like that, and maybe do a little demo on tapping or something. I don't know. These are just suggestions.
Oh yeah, I'm open to any or all of those.
Anything that can help, you and me and the universe. I think that's important, So I never guarantee anything. I say I throw it up on the universe and it spins. And where it stops, And I let it go that way, But I really want to thank you for taking the time. I mean, I'm so jealous you're at the beach. What beach are you at, Dr. K?
Well, Preston Beach in Swampscott.
Oh, that's right. I did ask you that. I'm sorry. Yeah, I'm not too familiar with that part of this. To me, that would be like me going, over the bridge. I mean, yes. I'm not that familiar with that whole area.
That's
but
okay.
I've been up there.
I'm not that familiar with the Dedham area, so.
I guess we're
it's
even.
All good, as they say.
It is all good, But I want to know if you'd like to give a message to the listening audience before we close.
So my message would be: learn to be your own advocate. Take your individual power back, because it's been with you all along. And I think sometimes we give it away to others out of, depending on what the situation is, and maybe that doesn't always put us in the best place, even if we did have the best interests at hand.
Thank you. That's good. Excellent. Well, again, I want to thank you for taking the time, really, out of your busy schedule to be on this show. And,
thanks, Jean. It's been a pleasure.
really has been, Dr. K. I want to thank the listening audience for listening. This is Jeannie White from Social Connections on Passionate World Radio, and today we had Dr. K on. She is into holistic. Her business is holistic, and she is also an author of books, children's books. So perhaps we'll have the doctor back on again. Maybe we can do a question and answer session. You never know how it's going to work. But again, thank you, everyone. I want to thank you all for having a good time with me and Dr. K. And have a great weekend, everyone. And see you again on the radio. Bye now.